Oh, wait. So, welcome to this episode, a special episode. Like to thank Grace for taking the time to interview with me today. We are spotlighting living and working in Prosper. So, this is Prosper, Texas. It's about 35 minutes, I would say, from DFW International Airport. It is known for its excellent school districts, and it's also known for a strong sense of community. So, this is a family oriented place. And so, today we are highlighting a local business. It is called Art, and we are so super excited. My name is Dr. Kendra Taylor Jones. I'm an occupational therapist of 20 years. I am licensed in Tennessee and Texas, and I'm also a real estate agent. So, today we're going to merge the best of both worlds. So, today I have Grace. Grace is going to help me introduce art to the community. If you are a family thinking of relocating, even a therapist, if you're thinking about, hey, I need another place, I want to expound on my practice area and I'm looking for a place to land. Here is Prosper. So today we are going to kind of talk about, it's so interesting that lately I have gained insight on, I would say, my core strengths. And not surprising, I am my top one of my top five is service. The other top five is empathy. And so today I would like to take the therapy world, merge it with the real estate world, empathizing with families needing certain types of homes, empathizing with families needing certain types of services. So today, Grace will introduce art. So, Grace, what is art?
Yes, hello. Like Kendra said, my name is Grace. I'm a board certified behavior analyst and clinical director here at ART. And ART is an acronym. It stands for Autism Response Team. And what we do, we provide ABA therapy, applied behavior analysis therapy, to children on the autism spectrum. And our clinic here in Prosper, we serve primarily early intervention, school readiness ages. So, up through kindergarten, first, second grade.
Okay.
So you'll see some of our kiddos start to kind of transfer out around 7 or 8, kind of depending on their skill level.
Okay.
But we got our little ones too. We got our 2 and 3 year
Oh.
olds, preschool age, and prepping them to start kindergarten and really kind of be able to integrate into their life,
Yes.
as and help them out in the community
Okay.
and really support these families. So yeah, what ABA therapy does is, the science of ABA really focuses on, different strategies regarding positive reinforcement.
Yes.
And different strategies that will help reduce challenging behaviors.
Yes.
And teach these little ones really important functional and appropriate replacement behaviors
Yes.
for challenging behaviors.
Yes.
So of course, we do address the symptoms of autism, which, of course, can make life a little bit more challenging,
Yes.
but it doesn't make
Yes.
life impossible.
Exactly.
And so we have so much fun hanging out with these kiddos. We are conducting therapy all day, but these little kids are learning through play.
Yes.
They are having a ton of fun.
Awesome.
And, we're really working to mimic the things that they're going to come in contact with in the real world.
Yes.
So, we're helping them with classroom readiness skills because these kids are going into the school setting.
Yes.
We're helping them out in the community for being able to attend a birthday party, go to a restaurant, go to the park, even really simple things like crossing the street in the parking lot, stuff like that. Being able to sit in a group setting, attend to, a story, those types of things.
Yes, yes.
And that's really just scratching the surface. I know. We have limited time, but that's what we do.
Well, that is a wonderful description. And I think lots of parents can, they can relate to that. They can relate as an occupational therapist. I know I can because we do pretty much some very similar therapy in getting children geared and ready for life. So life skills and exactly what you said. So that is wonderful. So tell us a little bit about what the enrollment process looked like.
Yeah, absolutely. So we have a lot of families come to us from all over. They're often getting referred from clinical psychologists or their pediatricians.
Okay.
And we do have kiddos come to us that already have an autism diagnosis.
Okay.
Because ABA therapy is a service, a medically
Mm.
necessary service
Mhm.
that you can receive through insurance. So
Okay,
it is covered
okay.
by insurance, which is
Good, good,
wonderful.
good. Yes.
And but you do need that diagnostic
Mhm.
label in order
Okay.
for it to be covered through insurance.
Okay.
But once they come to us,
Mhm.
we are able to begin that intake process
Okay.
and do our own assessment in-house.
Okay.
And that basically gives us an idea of where they are skill-wise.
Yes.
And we are able to formulate a individualized treatment plan
Yes.
for them.
Okay.
And we submit
Awesome.
that to insurance.
Okay.
So we, based on our assessment results, and when we meet the kiddo in the
Mhm,
clinic,
mhm.
we do a parent interview.
Yes.
We really get the full picture
Okay.
of who this kiddo is.
Yes.
And that is where we base our clinical recommendations
Okay.
off of.
Okay.
And then we ask for a specific number of hours through insurance.
Okay. Okay. Sounds
And so
good.
once all of that's done, they're able to start services with us.
Okay.
And, you know, we have kids that come to us full time.
Mhm.
We have kids that come to us kind of for after school social skills program.
Okay. Awesome.
So it really just depends on
the need of that
on their
particular
needs.
family.
Mhm.
Awesome. So I know that this is really good information. Another thing that I really, really wanted families to hear, there is an opportunity for a parent support group. So that is something where the child is getting the services that they need. Parent is getting additional information that they may need. And so as we were talking just a little while ago, when you relocate or you're looking for a place, I know a lot of families would love to plant themselves in a community as such, for the if nothing else, for the help for their children. Because I know when I relocated, I basically focused on, I wanted to be in a good school district, and that was like a non-negotiable. And so I can imagine what this program would be like for families that are looking for the additional services, and just need help with that one thing that just could change their lives. And so I think this is just a small, it's almost like a diamond in the rough. It's like I'm so happy that I was able to share this information,
Yeah.
and that you took the time to just share with us. Tell us a little bit about what you guys would look for in a qualified candidate looking for a job. What are you looking for, and what are some of the qualifications that people should probably have?
Absolutely. So we hire behavioral therapists, behavior
Okay.
techs,
Okay.
and we are looking for somebody with a passion and
Mhm.
with heart,
Absolutely.
and you know,
Absolutely.
somebody who is interested in wanting to work with kids,
Mhm.
wanting to change lives. You know,
Mhm.
it's definitely not an easy job, but it is one of the most rewarding jobs.
It is.
And really, you know, the requirements of the job in terms of certification. So
Mhm.
we when we bring on, you know, somebody new to the
Mhm.
field of ABA,
Mhm.
they, within their first 90 days, they do need to get their registered behavior technician
Okay.
certification.
Okay.
And that requires a 40-hour training that they get
Mhm.
completed in their first week of
Okay.
training when
Okay.
they start with us.
Awesome.
And then within their first 90 days, they
Mhm.
complete a competency assessment
Mhm.
with a supervisor.
Okay.
And then they sit for the RBT exam.
Okay.
So all of that, they get the support from us. They get the
Mhm.
training from us.
Awesome.
You know, we really help to guide them and get them ready for that.
Mhm. Mhm.
But that is a requirement of the job. So getting that RBT certification.
Okay.
And, you know, it on top of that, you know, those are kind of just the requirements on
Mhm.
paper. But on top of that, you know, we really are just looking for somebody that has that passion for the job,
Yes.
has the energy to play with kids.
Yes. Yes.
You know, is, you know, ready to come in every day,
Mhm.
ready for anything,
Mhm.
and no day is going to look the same.
Exactly.
So, you know, kind of just ready for the craziness of playing with
Yes.
kids, and
Yes.
you know, being able to kind of think on your toes,
Okay.
and you know, be flexible,
Mhm.
be able to you know, work with a team, be a
Yes.
good collaborator, all
Yes.
those things.
Yes. Good
Yeah.
deal. So, what would you, just as a highlight, what has been the most rewarding thing for you in this position?
Ooh, that's a deep question. So I've been with Art for 4 years now,
Okay.
and I have been in the field of ABA since about 2017.
Okay.
And you know, because it always starts with kind of that you know, ambition, you know,
Yes.
that, you know, wanting to, you know, drive your career and all those things.
Yes.
But once you get started in this field and you get to know the kids, and you get
Mhm.
to know the families, you really learn to love them, and you grow to
Mhm.
love them. And
Mhm.
seeing these kids break the craziest barriers
Yes.
and
Yes.
achieve these milestones that you couldn't even have
Mhm.
like imagined,
Mhm.
it's the coolest feeling. And
Yeah.
getting some of that validation from parents where, you know, they tell us, I can't believe that my child did this. Or,
Yes.
looking back, now that it's been a year, the things
Uh-huh.
that they're able to accomplish,
Yes. Yes.
that really does it, right? I mean, that's why we do it. And,
Yep.
we have moments like that all the time, kind of
Mm-hmm.
as a team, where we
Mm-hmm.
see these kids meet goals, develop skills that, we helped them get there.
Yes.
So
Yes. 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 Yes.
that's what keeps me going. That's the best part of it, for
Well, I
sure.
think that's the best why. So I
Yeah.
think with anything, when it gets hard and it's tough, a lot of times we are taught to go back to our why. And
Yep.
so, same here. So for OT, I think it's the same for me. I just love serving and helping families. I've seen the growth in a lot of my babies. I get attached really easily, but I just felt like this was just a wonderful opportunity just to share working in Prosper. Basically, I work in Prosper and you work in Prosper. A lot of people are living in Prosper. So I just wanted to introduce Prosper, Texas to the world via YouTube or however you may get this video. But I just want to thank you
Yeah.
so much for, I think, like we were talking before, if we just get one person to say, hey, I need this service, and if they're able to move or relocate or however it looks, if they're able to get in position to provide a better life for their family and their children, then we've done more than enough. So thank you so much.
Awesome.
All right.
Thank
And
you,
so we
Kendra.
enjoyed you guys today. Hopefully, this information will be helpful for you, your family, as a therapist. Hey, you're looking to relocate, Prosper, Texas. Families are just needing a better start, a fresh start, somewhere to take your children. Hey, Prosper, Texas. Autism Response Team, Prosper, Texas. They have several locations, but today we are highlighting Prosper. Thank you guys so much for watching, and we appreciate you being here. Thanks, Grace.
Thank you.
All
Thank you
right.
so much.